Now we will see the health trials of probiotics. As you know that whenever we have to use any pharmaceutical intervention or medicine or microorganisms, when they have to be used as food, before their approval they have to undergo certain human trials, rather animals trials first, and then they can go up to the clinical trial or human trials, after which they can be approved and the benefits can be actually confirmed, and then we can claim that these probiotics have certain health benefits when they are consumed. So if we talk about the human trials, especially these clinical trials, they are very essential to prove that some of the probiotics have any potential health benefits or not. So there are different designs that are applied for doing these kind of trials. They have got all their merits and demerits, and they're used under different conditions. It would also depend upon the kind of health benefit that we are studying. So they all would depend upon all these variables. But if we talk about different designs, they can be pre and post intervention designs. The pre and post intervention designs are the design in which we look at the condition, the outcome in a person who is not using an intervention, for example, probiotics, and then we feed them under control condition for a certain amount of time, the dose and the specific strains, and then we measure the outcome after consumption of these probiotics. So these are called as pre and post intervention designs. Similarly, there is another mechanism or another design that is used to see the efficacy of these probiotics or any other therapeutic agent. This is called as placebo-controlled designs. So placebo-controlled design is a design in which one group does not receive any medication or any treatment. They are called as placebo, and another group receives the therapeutic drugs or probiotics or any treatment that we want to test in these kind of designs. Then we have another design which is called as parallel designs. The parallel designs are, for example, we have group 1 and group 2, and in group 1 we are giving treatment A, and group 2 we are giving treatment B, and we then analyze them after giving that treatment. The crossover design is different than parallel design. The crossover design includes a situation in which, for example, the group 1 would be given a treatment A first and followed by treatment B, whereas the group 2 might be given the treatment B first and that is followed by treatment A, and then we look at the outcome of these intervention. Similarly, then there are case control designs as well. Case control designs are the one in which we look at an outcome, a certain outcome in a population or maybe in a group of individual or an individual, in which we see certain outcome and then we relate that, we go back in time and look at what were the factors that actually caused that outcome. So it is basically retrospective in nature. So this is called as case control studies. But as far as the trials are concerned for probiotics, I think the best one that have been used or they have produced better results are the one which are called double-blind, randomized, placebo-controlled trials. So these are the kind of trials which are more suitable for doing any kind of human trial or clinical trial for probiotics. Talking something more about the double-blind design is the design in which the experimenter and the patient, they do not know what treatment is being given to the patient, so it is blind on both sides. The randomized is completely randomized statistically so that we don't get into any biased when we analyze these results. And similarly, placebo-controlled trial, as I discussed, they are more suitable for human studies when the probiotics are taken as a research direction. If we talk about the epidemiological evidence that relates to probiotics, basically it would be an ideal situation, but it is very difficult to have any kind of epidemiological evidence due to many factors. For example, it is very difficult to control the epidemiological studies or the real life condition in which you can look at the specific strain and the specific dose, and then relating this with the certain kind of health benefit or disease. So this, ideally speaking, this would be not very much possible in the real life. But if we have any evidence like this, that would be very useful. We have to use certain markers whenever we do any clinical trial. Of course, it has to be measured by these markers. So there could be different kinds of markers available. You would see a lot of research publication having emphasis on different markers. So we look at, for example, having given these probiotic to people and looking at different markers. There are different kinds of markers basically that can be used for these human clinical trials. There could be markers that they tell you against the exposure of certain food. So we can select certain markers that tell us about exposure to a certain food, and then we can see that whether the food there has been exposure of a certain food or not. Similarly, another condition is when we have these markers that relate with the biological response. So we look at the biological response, and any marker or any molecule that is produced as a biological response, that is considered as a marker, and that is measured maybe before and after administration of probiotic to human in clinical trials. And similarly, there can be markers that look into the intermediate products of certain, say for example, the same biological response that we are talking about. We might look at certain intermediate marker that is an intermediate product of a certain biological function that can be tested and diagnosed in the lab conditions. So this was a little about human trials or clinical trials of probiotics, and the way and the different designs that are available, and how we choose different markers while doing these clinical trials.